when it comes to the quality of health care in urban communities.
Significant literature documenting that African American patients are treated differently than white patients.
Communities of color suffered a disproportionately high mortality rate.
And for those who are pregnant,
for some women, a trip to the doctor is terrifying.
Compared to white mothers, Black women in the U.S. are nearly 2.5 times more likely to die during or after birth.
The disparity in access to health care in communities of color cannot be ignored. Racism is a public health crisis.
For more than a decade, heart disease and cancer have claimed the top spots for the leading causes of death in the United States. And after 2020, the unrelenting virus of COVID-19 rivaled to take that top spot. But what if I told you that just being born Black instantly puts you at a far greater risk of death than your white counterparts? In this series, we will discuss the inequity stitched into our healthcare system. Simmons College of Kentucky presents The Deadly Diagnosis of Being Black. Dr. Stephen Kelsey is known and revered in the Louisville community. In 2006, he raced 2-year-old gunshot victim Erica Hughes to the hospital, and she survived.
I policed 25 years and trolling in the city's West End where there was a high volume of proliferation of crimes and drugs, low income. One day when I was in court, I heard the attorney say he's going to diversion. This is where most of the people go seek some therapy, be it DUI, domestic violence, what they call court monitor center. And so I began to inquire about it. I said, well, how can you be a part of this?
Dr. Kelsey serves an interesting role because he not only spends time in the courthouse and jailhouse, but also in God's house.
As a pastor and as a therapist, when I'm talking to somebody about the secular, so incorporate the spirituality so they go hand in hand, because if the Bible is also a sociology and a psychology book, because Paul said, be transformed by the renewing of your mind. Historically, African Americans, we did not go to counseling. It was some kind of stigma. You was considered crazy going to see a quack. But what has happened, people have leaned more on the church.
According to statistics, African Americans have a greater severity of untreated mental health disorders than any other racial group.
So as a pastor and as a therapist, we began to address the need, talk about the elephant in the room, because you have to understand when Adam sinned against God, he ran. And if you can't face what you're trying to conquer, you will never conquer it. If we don't address those specifics, the needs are not met, and mentally, I'm still not delivered.
Black suicide and youth suicide are on the rise here locally. How does the church minister to that and start the healing process?
Stop being afraid of talking about suicide. Pastors, tell your folk it's okay to have Jesus and a therapist. The Bible said Jesus was what? A wonderful counselor. Plus, he was also our Savior. So we need to advocate that it's okay to go see somebody, because prayer is good. But there are some things we have to help prayer begin to do. We got faith in prayer, but faith without works is dead. This is a whole different generation. They have not experienced the things we've experienced, so we have to come down to where they are to show them the value of self-worth, the value in your character, the value in your integrity, self-esteem. And the church needs to be a need-meeting agent.